pelvis? कोई एक बोल दीजिए जिससे आता है आपको, then I will tell you how to female pelvis is. Okay?
ये वाला होगा सेक्टम वाला रीजन है, बोन है, ये कॉक्सिस वाला है, इलामिनेट बोन है, उसके बाद में यहाँ पे इक्वेशन है और फिर
Thank you so much. So this is what Sumitra madam said, which is also true. But I will tell you more in more details. Okay. So our female pelvis is made of two innominate bone, two ischial bone, one sacrum and one coccyx. Okay. So this is the chart. Two part, two innominate bone, ischium, sacrum and coccyx. Okay. Then this pelvis is further divided into true pelvis and false pelvis. So which one is false pelvis?
above brim is the false pelvis and from brim to
So this pelvis also have three parts. Okay, one is inlet, which is gynecoid in shape. Inside is cavity, which is circular in shape, and the last one is outlet, which is oval in shape. Okay, this plays a very important role when baby is getting delivered. So I talk about this false pelvis and true pelvis. False pelvis means you know this two innominate bone. Above this innominate bone, it is called false pelvis. This part is false pelvis. Okay. Then from here, which is the inlet of the pelvis, then the down part, it is the true pelvis. So this is two important features of pelvis. Okay. And this inlet cavity is further divided, or it has a landmark. So how many landmarks are there in pelvis?
oblique transverse
Landmark. Nine landmarks is there. Can anyone tell what landmarks are? What are the landmarks?
Symphysis, pubis है.
No, आप जो पता है बोलिए, मैं दिखाती हूँ इधर.
line, tuberosity, it's a leg joint.
Okay, then I'll tell you. As you all know what are the landmarks, I'll tell you. First one is symphysis pubis. Okay, then is pubic crest. Pubic crest. Then is pubic tubercles. Then pectinal line. This is like pectinal line. Then there is little bit arch outlook. This is iliopectinal eminence. Then ilioeminence. Okay. Then iliopectinal line. Then come sacral articulation of ala of sacroiliac articulation. Okay, sacroiliac articulation, sacral promontory, ala of sacrum and sacral promontory. So altogether we have 9 landmarks. What is that? Symphysis pubis, pubic crest, pubic tubercles, pectinal line, iliopectinal eminence, iliopectinal line, and then this one, sacroiliac articulations, ala of sacrum and sacral promontory. So there are 9 landmarks. Okay. Any doubt? Okay. Then we'll come to the mechanism of labor. So before that, I'll tell you the diameter. Okay. So what are the diameters of the pelvis? Anterior, posterior, how much? 11. Transverse?
13.
And oblique?
12.
So these are the diameter of pelvis.
Pelvis.
Okay.
inlet.
Yeah, inlet. Yeah, I was discussing about the inlet, so I said that pelvis ka inlet. Okay. Okay. Is it visible? The other one is true pelvis. See, the false pelvis is from this side up is false pelvis. Inside the inlet, it is true pelvis. Okay. And diameter of pelvis, as explained, this is the anterior, posterior, transverse, and oblique diameter. So are the landmarks which I have shown you. See, symphysis pubic crest, pubic tubercles, pectineal line, iliopectineal line, iliopubic eminence. This protruding part is eminence. Iliopectineal line, then sacroiliac articulation, anterior border of ala of sacrum, and sacral promontory. Then comes the mechanism of labor. So mechanism of labor, it is a series of movements which occurs. Okay. So what happens is that in mechanism of labor there are 4 stages. What are the stages?
engagement.
That are the cardinal movements. Okay, stages होता है ना. First is propulsive stage, expulsive stage, placental expulsive stage, and the recovery stage. Okay, propulsive stages starts from bearing down of mother, contraction till there is full dilatation of cervix. Then expulsive, yeah, that is first stage. But this thing is also called as propulsive stage also. Okay. Then comes the expulsive stage. Expulsive stage में full dilatation of the cervix, the baby. Okay. Then comes the placental stage where the delivery of the baby and the delivery of the placenta. Then comes the recovery phase when the mother is kept for 2 hours and further bleeding is checked. Okay. These are the stages. So this mechanism of labor is guided by the 7 cardinal movements. What are they? क्या क्या होता है?
Engagement,
descent, then
flexion,
then
internal rotation of head,
then comes
expression,
then comes rounding. Rounding is not regarded as the movement. Okay, rounding comes along with the descent. Okay, then comes restitution. The head is delivered and restitution is followed by the internal rotation of the
shoulder.
So these are the cardinal movements which is present in the mechanism of labor. Okay, now I will show you how it is done. So what are the engaging diameter for the baby to engage? Transverse. Okay. The other one? Sometimes it can happen left occipital anterior and
right occipital anterior.
Okay. When it is engaged in transverse, there will be like internal rotation. जब होता है, it will be like 2/8 of the
2/8 circle.
Okay, 2/8 होता है. But when there is left occipital or right occipital anterior engagement, then there will be only 1/8 of the rotation. Okay. So there mainly क्या क्या होता है? 3 ट्रांसवर्स में एंगेज होता है, एक लेफ्ट ऑक्सीपिटल में एंगेज होता है और राइट ऑक्सीपिटल एंटीरियर नॉट पोस्टीरियर के एंटीरियर में एंगेज होता है. So I will show you. Okay. Now first I will show you in the left occipital anterior कैसे होता है. First there is an engagement होता है. Okay. Engagement के बाद क्या होता है? There will be descent. So there will be a descent. That means the head will come little down. Why the descent occur? Due to the uterine contraction and also the bearing down effort of the mother. So there will be descent. It will go little down. Okay. Descent. ये left occipital and anterior में engage हुआ है. हाँ ठीक है. Then comes the flexion. Flexion कैसे होता है? क्योंकि ये floor of the cervix को floor of the pelvis को reach करता है. And then what happens? The chin of the baby touches the chest of the baby. Then it will be flex. Okay. जब flex होता है तो क्या होता है? Presentation. Okay. See, vortex जैसे बोला था कहाँ से कहाँ पे सुमित्रा जी ने that will come. So you can see, okay. So ये vortex हो गया है ना. then the vertex comes. Then after that क्या होता है, bearing down effort, descent, इसमें descent यहाँ से लेकर यहाँ तक होता ही रहता है. Okay, it's a continuous process. So क्या होता है, after that there will be internal rotation. Since the engagement was only in left occipital anterior, there will be only 1/8 of the rotation. तो क्या होता है, rotation हो गया, internal rotation. ओके, जब ये इंटरनल रोटेशन होता है क्या होता है, ये ऑसिकुट कहाँ पे आता है, हम लोग का प्यूबिक सिम्फाइसिस, प्यूबिक और यू कैन से प्यूबिक आर्च के इधर आ जाता है. देन अगेन देयर विल बी अ डिसेंट ड्यू टू द कॉन्ट्रैक्शन एज वेल एज द बेयरिंग डाउन एफर्ट ऑफ द मदर. सो ये नीचे आ जाता है. वी सी द बेबी लाइक दिस. नाउ आप क्या देख सकते हैं, क्राउनिंग, क्राउनिंग हो जाता है. आफ्टर क्राउनिंग क्या होता है, हेड इज extend. तो every time when we see the head comes like this, okay, the head is extended because the occiput क्या हो जाता है, pubic arch के नीचे आ जाता है. तो head extend ऐसे होता है. then क्या होता है, after head extend there will be restitution. that is restitution मतलब external rotation of the head. एंड रेस्टिट्यूशन के साथ क्या होता है, इंटरनल रोटेशन ऑफ शोल्डर होता है. तो रेस्टिट्यूशन पहले ये कहाँ पे कैसे एंगेज हुआ था, लेफ्ट ऑसिपिटो एंटीरियर. तो रेस्टिट्यूशन में क्या होता है, ये हेड उसी तरफ टर्न हो जाता है. एंड व्हेन द हेड इज टर्निंग द शोल्डर आल्सो इंटरनली रोटेट्स, ऐसे हो जाता है. एंड व्हेन द हेड इज डिलीवर्ड, उसके बाद क्या होता है, हमारा पहला एंटीरियर शोल्डर गेट्स delivered. Okay, first anterior shoulder gets delivered, then the posterior shoulder gets delivered and the baby is delivered out. So this is what mechanism of labor is. Okay, understood? So next, ये मैंने आपको इसमें बोला था ना, this was in the position of left occipital anterior. अब जब ट्रांसवर्स में यहाँ पे एंगेज होता है तो क्या होता है, ये ट्रांसवर्स में एंगेज होता है तो देयर विल बी 2/8 ऑफ द रोटेशन. अभी इधर देखिए ऑसिकुट यहाँ पे ट्रांसवर्स में है, पेल्विस के पैरेलल हो गया है. ठीक है, देन क्या होता है, देन आफ्टर दैट ये पैरेलल हो गया है. देन व्हेन द डिसेंट ऑफर्स देयर विल बी अ फ्लेक्शन ऑफ हेड, हेड फ्लेक्स हो जाता है. Then there will be a internal rotation of the head. That एक बार first one rotation ऐसे होता है, तब वो position पे आ जाता है, left occipital anterior में आ जाता है. Then again descent होता है, तो फिर second rotation होता है, तभी ये है pubic arch के इधर आता है. ठीक है, that's why it is called 2 rotation in transverse and 1 rotation in 1/8 rotation in left occipital anterior. Okay, that is the only difference. Okay, then the head is delivered simultaneously, just how I have explained. Like head extend होता है, there will be internal rotation of the shoulder. Then the anterior shoulder will be delivered first. Then the posterior shoulder will be delivered first. Okay, this is how mechanism of labor occurs. Any question? हो रहा है या if there is like क्या होता है, मैल प्रेजेंटेशन जहाँ फेस आ जाता है, ग्लो आ जाता है, और मैल पोजिशन भी हो सकता है, जैसे बीच में हो सकता है. दिस इज वेरी इंपॉर्टेंट फॉर अस टू नो द मैकेनिज्म ऑफ लेबर. ओके, सो आई हैव one small video where you can see whatever that I have explained, it is explained properly. Tell you for the exam also. Okay, thank you.
Thank you.
So, आप healthy